When a man reaches about age 25, his prostate begins to grow. This natural growth is called Benign Prostatic Hyperplasia, or simply BPH, and it is the most common cause of prostate enlargement. BPH is a benign condition, meaning it is not cancerous and doesn't increase your chances of developing prostate cancer. However, both conditions can co-occur in the same man. If left untreated, it can lead to some annoying symptoms that no man wants to deal with. In this video, we'll discuss the signs and symptoms of an enlarged prostate and why every man needs to know about this life-detrimental condition to take control of their health and well-being. But first, let's talk about what exactly is prostate and what are the risk factors for BPH. In simple terms, the prostate is a small walnut-shaped gland that is located just below the bladder and in front of the rectum. Its primary functions are to create fluids in your semen and to aid in ejaculation. Your prostate will naturally grow as you age, but for some men, like those over the age of 50, this growth can become excessive and lead to BPH. Well, the exact cause of BPH is not known. There are certain risk factors like family history, being overweight or obese, diabetes, men who don't stay active, heart disease, and even men with erectile dysfunction that can increase your chances of developing BPH. Now that we know the risk factors, let's talk about the signs and symptoms of BPH. The first sign of benign prostatic hyperplasia is urinary frequency, which is the need to urinate more often than normal. This can be a frustrating problem for many men, especially during the nighttime when it disrupts sleep patterns. But why does this occur? Well, the oversized prostate puts pressure on the urethra, which is the tube that carries urine from the bladder out of the body. This makes it harder for urine to flow freely and results in more frequent trips to the bathroom. Even when the bladder is not completely full, men with BPH may feel the urge to urinate frequently due to this pressure on the urethra. While urinary frequency is a common symptom of BPH, it can also be caused by other conditions, such as urinary tract infections or bladder stones. So it's important to consult a healthcare professional for an accurate diagnosis to rule out any other underlying issues. Another common symptom of benign prostatic hyperplasia is urgency, which is a strong and sudden urge to urinate even when the bladder is not full. Imagine you're in a business meeting or spending quality time with your family, but all you can think about is finding the nearest bathroom to relieve yourself. It's not only inconvenient, but can also be embarrassing. This is because the enlarged prostate gland puts pressure on the urethra, making it more challenging for urine to flow out of the bladder, leading to a sense of urgency. Men with BPH may feel a need to urinate immediately and may be unable to delay it for long periods. Urinary urgency can also cause disruptions in daily life and lead to accidents or leakage if the person is unable to reach the bathroom on time. It can also contribute to anxiety and stress in men, which can impact their overall well-being. Like frequency, urgency is a common sign of BPH, but it can also be caused by other conditions like overactive bladder or UTI. If you experience sudden and strong urges to urinate, it's essential to consult a doctor for proper evaluation and treatment. The flow of urine may be weak or slow, particularly in the earlier stages of urination. A weak urine stream can make it hard to entirely empty the bladder, which, over time, can lead to urinary retention. It can be frustrating and uncomfortable for men to feel like they haven't fully emptied their bladder after using the bathroom. In addition, a weak urine stream can increase the risk of urinary tract infections and bladder stones, as well as incontinence or leakage of urine. This interrupted urine flow is also an essential indication of an enlarged prostate. During urination, the flow of urine may start and stop multiple times, indicating that the urethra is partially blocked. This issue can also be caused by other factors such as prostate infection or inflammation, nervous system disorders, pelvic muscle problems, and even side effects of surgery. So it's best to consult a doctor to determine the right course of treatment for this issue. Another sign that could be a red flag for BPH is the inability to empty your bladder completely. This means that even after urination, you may still feel like your bladder is not completely empty. You may also experience dribbling or leakage of urine after using the bathroom. This happens because an enlarged prostate gland can put stress on the urethra, making it harder for urine to flow out of the bladder. As a result, some men with BPH may have difficulty fully emptying their bladder, leading to urinary retention. This can be a source of embarrassment and can also increase the risk of serious complications like urinary tract infections or skin irritation. Again, it's important to mention that BPH can increase the chances of developing urinary tract infections due to the buildup of urine in the bladder. If you notice that you are not able to completely empty your bladder, don't brush it off as a normal part of aging. It's crucial to consult a doctor for proper evaluation and treatment. Sometimes, men with benign prostatic hyperplasia may experience pain or a burning sensation during urination due to irritation of the bladder or urethra. This irritation can occur because the bladder has difficulty emptying, leading to urine retention and buildup of bacteria, which can cause inflammation and discomfort. Another crucial sign of BPH is the presence of blood in urine, also known as hematuria. This can happen when the enlarged prostate gland puts pressure on the urethra and causes irritation and inflammation, leading to the presence of blood in the urine. The color of blood in urine can range from light pink to deep red, depending on the severity of the condition. In some cases, the amount of blood may be small and not visibly noticeable, but it can still be detected through a urine test. However, in more severe cases, the blood may be noticeable and accompanied by pain or discomfort during urination. It's important to mention that blood in urine can also be a sign of other serious conditions, such as prostate cancer. Therefore, it's crucial to consult a doctor if you notice blood in your urine, even if it's just a small amount. The last common sign of benign prostatic hyperplasia is that it can cause sexual problems. Well, it may sound surprising, but it's true. Having an enlarged prostate can indeed affect a man's sex life. One of the main issues that can arise due to BPH is erectile dysfunction. ED, also known as impotence, is a condition where a man cannot maintain an erection firm enough for sexual intercourse. This can have a significant impact on a man's self-esteem, relationships, and overall quality of life. BPH can also lead to a decreased libido, reducing a man's sexual desire and appetite. In addition, BPH can also contribute to reduced sexual satisfaction due to pain and discomfort experienced during ejaculation. This can greatly affect a man's ability to enjoy and feel satisfied with their sex life. Moreover, an enlarged prostate can cause retrograde ejaculation, where semen enters the bladder instead of exiting the body normally. While this may not be harmful, it can have an impact on fertility and may cause concerns for men trying to conceive with their partner. These sexual problems can also be caused by other factors, so before jumping to any conclusions, it's best to consult a doctor for proper evaluation and treatment. It's important to note that not all men with benign prostatic hyperplasia will experience all of these symptoms. Some men may only experience one or two, while others may experience a combination of them. Additionally, the severity and frequency of these symptoms can vary from person to person. That's why it's crucial to consult a doctor if you notice any changes in your urination habits or overall health. Early detection and proper treatment of BPH can significantly improve your quality of life and prevent potential complications. Remember, BPH is a common condition that affects many men, especially as they age, so there's no need to be embarrassed or ashamed to seek help. We really hope this video has helped you understand the signs and symptoms of benign prostatic hyperplasia and why it's important to address them. If you find this video helpful, please don't forget to hit that like button and subscribe to our channel for more informative content on health.